Uganda has aimed to halve the malaria mortality by 2010 through implementing strategies and actions agreed at the African Summit on Rollback Malaria, RBM.
We want really to reduce malaria morbidity and mortality, because malaria is the leading cause of morbidity and mortality in this country. So once we have effective interventions like long-lasting nets, then we should be able really to have an impact on malaria in this country.
Implemented by civil society organizations, supported by Uganda Health Marketing Group and UNICEF, and in cooperation with the Ministry of Health, this campaign focused on a simple and proven method of preventing malaria, the long-lasting insecticide-treated net. The approach for distribution that was adopted under Global Fund Round 7 has been that of universal coverage, with a strategy of targeting most vulnerable groups of children under 5 and pregnant women in Phase 1, followed by an upcoming second phase distributing nets to all households across the district.
For the planning purposes, we have defined universal coverage in Uganda to mean a net for every 2 persons, and looking at the fact that an average household in Uganda has 6 people, this equates to 3 nets per household.
The aim of this campaign is to achieve rapid scale-up of net coverage, sub-county by sub-county, eventually covering the whole of Uganda. Existing and proven implementation guidelines provide clear step-by-step instructions to plan, implement, monitor and evaluate mass distribution campaigns and are used by all implementing partners.
It's it's like a military exercise distributing these nets. It's a huge undertaking, 7.4 million nets. It's mind-boggling. If you imagine those nets seated in Mombasa and having to come all the way from a big truck into the little trucks and to the little trucks up to the district and village level. It's quite a huge undertaking, so we needed all the partners.
Many partners. This is how it works. While Global Fund procures and delivers the nets to Kampala, PACE transports them to sub-county stores. UNICEF supports logistics management and SMP offers technical and logistical support. The Ministry of Health plan coordinates and supervises throughout the campaign, closely overlooked by the National Drug Authority and Uganda Bureau of Statistics for quality control and assurance of the nets. UHMG, contracted through UNICEF, mediates this whole process and offers technical support in terms of management, logistics and operations to the implementing local civil society organizations. The CSOs work through the public health system and distributes the nets together with village health teams to the beneficiaries.
You would have expected that it would be hard to work with quite a number of players. But the good thing is that they all had their different roles and responsibilities well segregated.
I put UHMG to task to report, and they were excellent in reporting, excellent in pointing out any challenges or would-be challenges before they occurred or when they were occurring, so I could touch base with the Ministry of Health, touch base with the malaria control program to ensure that things moved smoothly.
So we're providing logistics support, and in certain cases, we ourselves were actually doing the support supervision with these civil society organizations.
By capacity building local CSOs, they have been able to acquire the technical knowledge and actual experience in the planning, implementation, and monitoring and evaluation of quality net distributions in their communities.
It's better to use the existing structures to implement a governmental program, because these are the people who live and stay among the communities and the civil society at large.
The major implementation steps involve planning and sensitization of district leaders and trainers, registration of households through village health teams, allocation of the nets supervised by sub-county supervisors, UHMG and Ministry of Health, and finally, distribution at designated distribution points at parish centers. After the VHTs confirm the person's name on the list, a net removed from the packaging is handed over, a measure taken to prevent resale of the free nets. Each person receiving a net signs or marks the list to confirm they have received it. A designated committee is responsible for campaign advocacy, communication plans, tools and messages for activities pre, during, and post-campaign, ensuring that messages are targeted to local needs, encouraging net usage and maintenance, and addressing potential barriers.
My role is to sensitize the people to know the purpose why you are giving these people the long-lasting insecticide-treated nets. What is their purpose?
The aim is to make the district people own this program and work as if it is theirs, and then also prepare for follow-up so that they can sustain the program even after the partner goes out of this program.
Following the distribution, the CSOs are facilitated to conduct a follow-up exercise to beneficiaries in their homes, providing additional support in the hanging, use, and maintenance of the nets.
Indeed, before we go to the nets, we use it to catch malaria, then go to a health center to get treatment. But now, as the mosquito gets in contact, even before it tries to enter, it dies.
Key results, data, and experiences, including challenges, solutions, and opportunities, are shared among CSOs supported by the facility, as well as disseminated to the NMCP and other interested rollback malaria RBM partners.
The main achievement was to see that the coverage attained was as high as we had planned on paper. That rarely ever happens. So I'm fully satisfied that the nets went out. There was very little pilferage, if at all. And I'm now looking forward to the use of these nets.
Through this mechanism, 7.4 million nets have successfully been distributed for Phase 1 between May and December 2010.